Welcome to Whiston Hospital's maternity unit, and thank you for choosing us to provide your care during your pregnancy, delivery and postnatal period. We understand during the coronavirus pandemic that you may be feeling more anxious about your pregnancy and having a new baby. But we want to reassure you that we are here to support and care for you right throughout your pregnancy and birth. We will do everything we can to make sure this experience is positive, and we look forward to sharing this happy event with you.
We aim to offer personalised care in a friendly, supportive and safe environment for women, their partners and their babies. There have been a number of changes during the pandemic, and we will try to explain more in this film while showing you the services we provide. Our team of experts include midwives, healthcare assistants, maternity support workers, obstetricians, sonographers, paediatricians, neonatal nurses, and other professionals and support staff who all work together to deliver an excellent, safe, and high-quality service. Here is a brief introduction to our services.
Hello, welcome to Women's Outpatient Departments. This is where you'll receive your antenatal care.
Antenatal care is the term used to describe the care we provide to you during your pregnancy. Although we aim for midwifery-led care, we also provide a range of specialist multidisciplinary clinics for women whose pregnancies may be complicated by other medical conditions such as diabetes. We offer antenatal screening and provide advice to all women who book with us. During your pregnancy, you will have antenatal care in the community setting, provided by our community midwifery team. Unless you are classed as high risk, then your antenatal care may be provided at the hospital. During the pandemic, some antenatal appointments, such as your initial booking appointment, will take place as a telephone appointment, and our teams will inform you of this at the time of booking. You will still have your scans at the hospital. If you are attending an appointment or scan at the hospital, we currently ask that women attend their appointment alone. If you need someone to bring you to the appointment, then we ask that they wait for you outside and do not enter the hospital or clinic.
Welcome to our Feto-Maternal Assessment Unit.
The Feto-Maternal Assessment Unit is a relaxing and informal environment created for mothers requiring monitoring of at-risk pregnancies or further investigations in their pregnancy on an outpatient basis. The unit operates an appointment system and is open to referrals from GPs, community midwives, and patients who are already under the care of the unit. Again, during the pandemic, we ask that women attend the Feto-Maternal Assessment Unit alone to reduce the risk of spreading infection.
If your pregnancy is low risk and you have no underlying health conditions, you may choose to give birth at home.
Being at home can help you feel more in control and more able to relax during your labour. Home birth is also known to reduce the need for pain relief and further intervention. A midwife will provide care during labour and following the birth in your own home. Midwives are trained to help you give birth at home safely, but should there be a problem at any point during the labour, they may advise you to transfer to the hospital. During the pandemic, our midwives will be taking extra precautions during home visits, and we ask that you clearly follow any instructions provided to prepare your home before they visit.
If you choose to give birth in hospital, then our maternity unit provides a relaxing environment for you to give birth to your baby.
Our unit is specially designed to ensure we can provide the highest standards of personalised care that meets the needs of women and their families. Our rooms are large and comfortable, with 3 birthing pools available. If you believe that you are in labour or your waters have broken, then please contact our triage unit before you travel to the hospital. All contact details for the unit are in your maternity information pack. During the pandemic, only one named birthing partner is permitted to accompany women in labour. If you require induction, then you should attend the ward alone, and your birth partner can join you once you are in established labour, on delivery, or Sapphire Suite. If you require admission before or after the birth, then unfortunately, we cannot allow visitors onto the ward whilst the pandemic is ongoing.
This is Sapphire Suite, our midwifery-led unit.
Sapphire Suite is designed for women with low risk of complications. Our teams specialise in providing care which helps women to give birth without medical interventions. Sapphire Suite has 3 rooms, 2 of which have birthing pools for pain relief, and you can also birth in the pool too. The rooms have birthing mats, balls and couches to enable a more comfortable delivery with mood lighting and music. Sapphire Suite is managed by experienced midwives, but should complications occur or if you request an epidural for pain relief, you will be transferred to the nearby consultant-led delivery suite.
Welcome to Delivery Suite.
If you have underlying health conditions, request an epidural for pain relief, or attend as an emergency, you'll be cared for on Delivery Suite. Care is delivered by a team including obstetricians, doctors who specialise in birth, and midwives. Our Delivery Suite has 11 fully equipped private rooms with en-suite facilities. Birthing balls to aid comfort throughout labour and promote an active birth are available in all rooms, as well as mood lighting and music facilities. There is one birthing pool available on Delivery Suite. You and your baby can go home from the unit if you are both clinically well. Otherwise, you will be cared for on Ward 2E. The majority of women who have vaginal births can go home within 24 hours of birth, when their care is transferred to the community midwifery team.
We have a dedicated theatre team attached to Delivery Suite.
Should you elect to have a caesarean section, or should our medical staff advise you that this is the safest option for you and your baby, you will give birth in our dedicated delivery theatre. The theatre may also be used if medical staff need to provide extra assistance to you during a vaginal birth. Following birth, you and your baby will then be transferred back to Delivery Suite or straight to the postnatal ward.
Hello and welcome to Ward 2E.
You will stay on Ward 2E if you need overnight monitoring or investigations before you give birth and following delivery, if your midwife or medical staff advise you that this is necessary. Where possible, women who require monitoring before birth will stay in a separate area to those who have already delivered their baby. This is to ensure that your rest is not disrupted during the night. If you need an overnight stay with us following birth, you will stay in one of our 4-bedded bays or in your own single room. Priority for single rooms is given to women or their baby who have a medical requirement. Unfortunately, during the coronavirus pandemic, we cannot allow visitors, including partners, onto the ward. We understand this may be upsetting for you and your loved ones, but the decision has been taken in order to protect you and your baby. Our staff are here to support you at all times and will do their best to make sure you have everything you need whilst in our care.
We also have a dedicated community midwifery team.
The community midwifery team provide both antenatal and postnatal care. You will visit your community midwife throughout your pregnancy at your GP surgery or a midwifery clinic in your area. They will monitor your progress throughout, and should they have any concerns about the development of your baby or your own health, they will refer you to the hospital service for monitoring. The community midwives are also on call 24 hours a day for women with a low-risk pregnancy that choose to have a home birth. You will receive 2 home visits from your community midwife after the birth of your baby to check your health and baby's progress. Your care will then be taken over by the community health visitor.
Welcome to a special place for special babies.
Our Special Care Baby Unit looks after babies who require some form of treatment or a high level of observation following birth. This could be for babies born prematurely or unwell who require either special care, high dependency, or short-term intensive care. Babies who need long-term intensive care are transferred to the nearest hospital with these facilities. In the Special Care Baby Unit, our specially trained neonatal nurses will look after your baby, along with the expert medical team to optimise your baby's care.
Our dedicated team of midwives are on hand to help you with any questions you may have about being a parent and looking after your little one.
Currently, due to social distancing measures required, we are unable to offer some of the specialist midwifery and community services in the hospital, such as parent craft, hypnobirthing, infant feeding drop-in sessions, and our tours of the unit. However, our teams are still here to support you, and you can contact the services directly with any queries you may have. Our midwives will be happy to advise you.
If you are worried about the health of you or your baby during your pregnancy, please call our Maternity Triage and they will offer advice and support. Your maternity care is important and you should not let any concerns regarding the coronavirus stop you from contacting us. If you need to come into hospital, we have precautions in place to protect you and your baby. Welcoming a new baby should be a happy time and we are here to support you to have a positive experience. We look forward to seeing you and your little one very soon.